This is Live Well Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. As COVID-19 cases continue to rise in our community, we will once again be recording COVID-19 update podcast on a weekly to bi-weekly basis. Today's podcast and all podcasts recorded after this date will be recorded virtually over Microsoft Teams until further notice to ensure social distancing measures are in place. Today's COVID-19 update is being recorded at 8:30 in the a.m. on Friday, November 20th. I wanted to start today to compliment the staff, the inspirational activities that they've done, aspirational as well. They've continued to be so brave during these times. Without fear, they approach caring for COVID-19 patients. 3 weeks ago, we were in the mid 40s on the number of COVID patients we had. And at that juncture, we felt like we were possibly overwhelmed. And if it hit 50, we would be in trouble. This week, we're handling 85, and it's like it's business as usual. We're working busy. We're tired, but it's just amazing how the growth that I've seen in the ability to handle this situation. And perhaps I shouldn't be amazed. It's kind of the expectation that I have for these professionals that I work with, and I'm very proud of. The cases have continued to rise, and I get a lot of questions about wearing a mask. And the recent Denmark study that said masks are not effective. That study said masks are not effective for protection, that wearing a mask doesn't protect you from getting the virus, but that wearing a mask does prevent the virus being transmitted, that patients have it. So COVID-19 has, we believe, all evidence points towards it, as tremendous asymptomatic transmission. So wearing a mask prevents the asymptomatic person from spreading the virus in the community. It's that simple. So although the evidence doesn't support wearing a mask, it will slow down the transmission. And as I've said before, that there's no study that says wearing a parachute while jumping out of an airplane is a good idea, but I think we'd all agree that wearing a parachute is the way to go. Therefore, I would think of masks as the same way. The limitation on the mask is the quality of the mask. I think I prefer the surgical mask. I think the cloth masks that are worn may prevent transmission in crowded environments when the duration of time exceeds the 15-minute milestone. As I look at the data and the reporting this morning on Friday the 20th, I see something that's very optimistic, and that is the RO or R naught value for COVID-19 in Linn County has dropped to 0.87. It was about 1.46 at the highest, maybe 1.5. What does that mean? That means for every case of COVID, 1.5 people would get it. So that means it's spreading the community. Once that number drops below 1, which it has been for 2 days in a row, that indicates that the prevalence is decreasing, and perhaps we have passed the peak and we are turning the corner. So that's cautiously optimistic, but optimistic nonetheless. One other thing I wanted to clarify is that the in-house testing that we do here at the hospital sometimes is referred to as rapid testing, and that's not really accurate. It's rapid in that it takes less time to do because it's not sent outside the hospital, but it's the same identical PCR technology that is used. And so that is reassurance to people that it is not the rapid test, which is an antigen-based test that maybe does not have the accuracy that the PCR test has. That's probably more than anyone wants to know about testing. Testing is starting to be done at Walgreens, and I think I've heard that Hy-Vee might be starting testing. I don't have experience with that. At this time, the medical staff, we are accepting positive results from third-party testers or the vendor testers from that standpoint. And as time evolves, we'll have more confidence with the testing and use the testing results as we would any other results. The other point I wanted to cover this morning is to note that Thanksgiving is coming up, one of everyone's favorite holidays. It marks kind of the winter holiday season as the beginning of it. And what should we do to socially distance during the holiday? My recommendation is keep the holiday with your immediate family this year, and perhaps have an area where if you do have high-risk individuals and the benefit of attending the holiday meal is greater than the risk of getting COVID, then socially distance as much as possible in the home. Have individuals not serve themselves, but perhaps have one person serve the food during the meal. And I think not sharing or no family style dining will prevent the transmission to the degree it's possible. And if possible, ventilate the room as well. I don't think it's going to be in the 60s next week as it has been the last 2 days. But if it is, certainly open the windows and let the air in. Overall, I'm optimistic that we, as I've said, we've built the plane as we were flying it back in March. The plane's built. We know how to fly it. We fly it well. And we've been through some turbulence, but we are getting through it, and we'll continue to get through it. Thanks for listening to today's COVID-19 Update podcast. For the most up-to-date information on COVID-19, visit our website at unipoint.org or the Centers for Disease Control and Prevention website at cdc.gov. And remember the 3 W's. Wash your hands frequently, wear your mask, and watch for social distancing.
Thank you for listening to Live Well Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.